Okay.
Ready?
Yes, ma'am.
All right. The Board of Certified Advanced Estheticians meeting is convening at 9:06 a.m. on February 21st, 2024. This meeting is being held in person and via MS Teams video conference and is being recorded. The recording will be posted to the internet for public viewing. The Health Licensing Office asks that individuals attending through MS Teams keep your phone muted and cameras off during the entire meeting until you are given an opportunity to comment during the public and interested parties feedback period if indicated on the agenda. Please do not use the chat feature during meetings. I will now call roll. Christina, here. David Howe?
Here.
Kimberly Canaday?
Here.
Jamie O'Neill?
Here.
Kimberly Morris? Rachel Anthony? Christina Russ?
Here.
Olivia Gill?
Here.
So currently, Kimberly Morris and Rachel Anthony did not respond. Members, when you wish to speak, please state your last name for the record. Board members are asked to not use the chat feature during meetings. Public members wishing to speak must first sign in on the roster sheet available. For public members on MS Teams, please email Carrie Edwards at carrie.edwards@oha.oregon.gov and provide your first and last name. Public and interested parties feedback may be heard during the public and interested parties feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. This meeting is called to order.
Excellent.
You want to go
Good.
through introductions before approval of agenda?
Sure.
Okay. See, it looks like we have some new members.
We do. We can start with them if you would like, Chair.
That sounds great. So we have Christina Russ, Olivia Gill, and Rachel Anthony was at our last meeting, correct?
I'm hearing yes.
So we have Christina Russ and Olivia Gill. We would love to have you guys introduce yourself.
Okay, well, Christina Russ here. Let's see, I've been in the Oregon area for 13 years. I've had my aesthetics license since 2007. And I was also previously on this board in the very beginning. I feel like it was maybe 2017 when I last served. So it's been some time and I've been a little bit out of the industry, but I'm wanting to kind of get back in as it's always been my true passion. So yeah, I live here in Bend and am looking forward to being part of the board again.
Welcome back.
Thank you.
Olivia?
Hi, I'm Olivia Gill. I got my license in 2014 and probably since 2015 have been working with lasers and being a certified advanced esthetician. I actually went to the board meetings in high school to kind of see what Oregon was going to decide, whether I had to be a nurse or be a certified advanced esthetician. So I'm somewhat familiar, but my first time serving, and I'm excited to be here.
Welcome. We're
Yes,
very
welcome.
happy to have you. Let's go ahead and move on with our agenda. Do I have a motion to approve the agenda?
We should probably introduce ourselves so they know who everybody is, like who
Oh.
you are. And
Do you want board members or do you want the staff? Like, do you want to go through that list, Sammy?
Bob's in the room, so maybe
Bob?
he can, but
Okay,
probably both.
yeah. Yeah, we'll do both. Christy, we can start with you since you're at the top of the list.
Oh, well, I wasn't planning on talking about myself, but I have been in the laser business since 2008. Have 2 facilities, and I just really want to do what I can to help our industry and to help communication between all of the overlaying things going on as our industry changes. So I'm always willing to help in any way I can.
David, you're next on the list.
Okay, good morning. David Howe. I'm the program director from Oregon Health Authority's Radiation Protection Services. And because we have statutory authority to regulate lasers, that's why I'm a part of this group. And I've been with the state since 2007, so for a while, and been a part of the rulemaking and different things with the group. So that's me.
Excellent. Kimberly.
Hi, this is Kimberly Canaday. I am a nurse practitioner. I've been in the aesthetic world for going on 8 years, and I'm in the Bend area, and I'm just doing this to help also facilitate communication, understand how we can and should be compliant within the clinic setting. Thanks.
Jamie, or was she one of the new board members?
Nope,
Nope.
Jamie's
Go ahead,
been
Jamie.
here and yep.
Hello, I'm Jamie O'Neill, and I've been in the laser industry since 2008. Have a practice in Portland, and been on the board, and I also served on the Rules Advisory Committee as well a couple of years ago. That's me.
Excellent. Thank you. Sammy?
Good morning. This is Sammy Patnode. I'm the analyst for this board since it was created in 2015. And so I helped develop the board, bring the rules on, and make any changes with help with the device rules that we recently did. And I've been with the office for 27 long years, almost 3 decades. I like saying that. Welcome, new board members.
And I see Tina's on there. Tina.
Good morning,
You're first.
everybody. I'm Tina Russell. I'm the licensing manager. Along with Sammy, I've been here 27 years too. And I'm here to help in whatever way I can. Welcome.
And so you all probably know Derek. Derek, are you on there? I see you're on there, but are you listening?
I am. Hi, everyone. My name is Derek Foltz. I'm executive support. I've been with Office for a little over 5 years now, and a large part of my job is board member recruitment. So new board members will hear from me, and anyone who's ready to reappoint, you probably will also likely hear from me.
Okay, Chair, just a note real quick, Kimberly Morris is coming on. And last but not least, everybody, Chair, members of the board, my name is Bob Bothwell. I am the interim director here at the Health Licensing Office. I have been with state government 32 years and with health licensing about 12 of those years. Chair, we can give Kimberly an opportunity to introduce herself if she can hear us.
Kimberly
Kimberly
Morris. Are you
Morris.
on? Yeah.
I'm here. Hi, everybody. You don't get
Morning.
to see my fabulous face today because I'm in my jammies still doing schoolwork. So, hi, everyone. I'm Kimberly. I own Skin Aesthetics and Laser. I have been an advanced esthetician for, I don't know, a decade now. Just kidding. A good amount of time. I'm finishing my nursing degree, my bachelor's, and then going towards my nurse practitioners and hoping to be my own medical director and growing my practice in a different state as well.
Excellent. Thank you very much.
Good. Thank you.
Great. Okay, I assume everyone has a copy of the agenda. And does someone want to make a motion to approve agenda?
I'm Jamie O'Neill. I'll make a motion to approve agenda.
And do we have a second?
Christy Ross, I second that.
Thank you. The agenda's been approved.
Chair, we need a vote, please.
Oh, sorry. Thank you. I'm a little bit I feel like I've only done this a few times.
Not a
Let
problem.
me pull up my list here. All right, I will now call a vote. If you approve the agenda, please indicate by saying yay or nay. Christy Knapp, yay. Kimberly Canaday,
Yay.
Jamie O'Neill,
Yay.
Kimberly Morris.
Yay.
I believe Rachel Anthony is still absent. Christina Russ
Yay.
and Olivia Gill.
Yay.
All right, thank you. The
Excellent.
agenda's been approved.
Thank you, Chair. And then I don't think we have any more votes, but should we have votes and in the future, if someone's missing or absent, you don't have to call them.
Okay, thank you. Okay.
So next on the agenda is reports. Chair and members, would it be easier if I just shared my screen so we can all follow along? I think I just learned how to do that recently.
That'd be great.
So I will do that. So I have to call out the pages. Okay. Is everybody seeing the agenda?
I'm not seeing it.
No, I'm not seeing it.
Yeah, there's nothing there. Bob, you gotta go to your other screen.
How's that?
There it is.
Got it.
Yeah.
Yeah. I'll zoom it in a little bit. No, not everybody's as blind as I am, but I know it's difficult to see when somebody's sharing. So I'll just scroll down here. All right. And so the first item on the list is the board members' statistics. So we can see there, I can read it. It's real quick. Christy Knapp's in her second full term, which expires 12/31/2025. And Christy, unfortunately, you won't be able to reappoint. Jamie O'Neill is in the first, and that term expires 4/24/27, and Jamie can reappoint. Rachel Anthony, first full term as well, expires 5/26/2026 and can reappoint. Kimberly Morris, first full term, and that term expires 12/31/2025, can reappoint. Olivia Gill, first partial, 12/31/2024, can reappoint. Christina Russ, first full, expires 12/31/27, also can reappoint. Kimberly Canaday, first full, expires 6/30/2025 and can reappoint. And we do have David, who is sentenced till he retires to be on the board, part of the board. And currently we have vacant positions for the public members and a nurse practitioner. Licenses issued. Some of you may or may not know government runs differently than on a different calendar year when it comes to finances and statistics. Typically, the year for us runs July 1 of a particular year till June 30 of the following year. So currently we are in Q3 of 2024. And we've issued 9 licenses just in this quarter, and the quarter's not over yet. I'm gonna minimize this a little bit. Can everybody still see that?
Yeah, we can see it.
Oh, okay. I was like, uh-oh, what happened? So as you can see, currently we have issued 278 licenses between fiscal year 22 and currently in 2024. Licenses renewed online most everybody renews online, and we're slowly trailing off on the paper renewals, which is nice, makes things easier on our end. And in that same time frame of fiscal year 2022 and currently in 2024, we've issued a total of 1,263 renewed, sorry, 1,263 licenses, licensed by age and gender. As we can see that, I don't know what they are. I'm gonna guess that those that identify as female are the vast majority, and it appears to be a relatively young group of licensees. Licensing trends, it's a good sign. The trajectory is always going up. The examination statistics also relatively, not relatively, is good. In the last 2.5 fiscal years, we've had a total of 275 folks pass the test and only 38 fail the test. And statistics, financials. Currently, we started this fiscal year with a beginning cash balance of $143,878, brought in a total of $35,438, and we've expended $31,538. Net operations of 3,900 and a total ending balance of $147,777. Kind of dry, I know. Does anybody have any questions? Okay, moving on. Trampus, are you with us?
I am.
And I forgot to have you introduce yourself. I apologize. I did not see your bubble. So you want to introduce yourself real quick for the board and give your regulatory report, please.
I will. My name is Trampus Shuck. I am the interim regulatory manager for the Health Licensing Office. I've been with the office for about 15 years. Most of that time has been spent in the regulatory department, but I did spend some time in licensing, working with Sammy. Yeah, so I welcome the new board members, and I'm here to talk about the regulatory report. So the regulatory report has a couple of different sections on it, especially for the new members. I'll give a little bit of explanation as to what those are. So you're going to see off to the left, you'll see cases open/closed status, and you'll see a couple of different years up there. Those are biennium. So for the 2021 biennium, for example, we only received six cases for that biennium, and only one of those is still open. I will point out a little bit about what open and closed means. I know that seems pretty self-explanatory, but it can mean a little bit. It means something a little bit more specific than just what it implies. Open means that the investigation is still ongoing. Or it's in the administrative review phase, or it is waiting to be reviewed for the board. It really is open until either it's closed as unfounded, or it's been reviewed by the board, or a notice has gone out. So there's a time frame where the investigation can be done, but it's just in administrative phase. Closed just means it's completely closed. So as you can see, like I said, there's 3 biennium on there. The 2025 is the current one. So we've only got 2 cases that have come in, and those are still open, which is pretty much to be expected. And the 2023 biennium is the one with the most active open cases, where we received 18, 12 of which are still open. So the complaints by type, you can see we have a specific call out for laser services. licensing concerns, safety, sanitations, and services provided. Licensing concerns are going to be pretty much anything that has to do with unlicensed practice. So if there's any, if somebody is practicing, somebody's a cosmetology esthetician, doesn't have their advanced aesthetics license, and they're doing laser hair removal, that would be kind of thing that's in the licensing concern section. Services provided are typically going to be regarding, somebody claims either they were injured, it could just be, anything kind of along those lines, that the services they were provided were not adequate in some way. And that could be the results that they got were not good enough, they didn't feel, or that could be, an injury or something like that. And safety and sanitation is pretty self-explanatory. I think that's where somebody complains about, somebody's not, the place is dirty or something like that. This group doesn't get a lot of those complaints. You would see that more in the cosmetology, where somebody is going to complain about that. So if somebody complained about a facility not being cleaned, it actually, even if it was an advanced esthetician working there, it's possible that would have been opened up on the facility, which is a cosmetology, would be more of a cosmetology investigation. So sometimes you get into a little bit of jurisdictional strangeness because one license relies on the other one for this board. So, but that gives you a pretty good overview of what's going on there. Complaints by type, anonymous. We just don't know who complained. That could be. Those are probably going to be more likely like a licensing issue, but we don't break it down that way. The client, the actual client themselves complained. Other is some third party, or there was some reason it wasn't notated, but it could just be any third party. It could be an attorney, probably that would be a client, but it could be, just a third party saying, hey, I see over here they're doing stuff they're not supposed to be doing, or whatnot. Just somebody we know who they are, but they're not necessarily connected to the client. So that is the regulatory report in long format. Does anybody have any questions about the regulatory report, or anything that I put out there, or just anything about investigations or inspections or regulatory in general?
I kind of do. Who would be in regulation of, I see a fair amount of, an office has a medical director, and then they have injectors that are not independent licensed providers. Who is in regulation between the Board of Nursing and the Oregon Medical Board, what they state as the responsibility of the medical director?
Right. So if you're talking about something like Botox or injectables, injectables are not part of the scope of practice of either cosmetologists, estheticians, or advanced estheticians. So when you're talking about that type of situation, it becomes, and there's a medical director involved, it's probably going to be more so directed to the medical board, because they're the ones who are taking responsibility for those, the people that are working for them. If you had an advanced esthetician or an esthetician that was doing Botox injections and there was no medical personnel that was taking responsibility for that, then that would most likely be investigated by us, and it would be a scope of practice issue, or stepping outside of their scope, the esthetician or the advanced esthetician scope of practice. So that's how we would investigate it.
So the Board of Nursing has a regulatory,
right,
and the Oregon Medical Board has a regulatory.
Right. So if the board,
separate.
That's right. So if you had somebody who was a nurse practitioner or any kind of nurse in general, and they were doing, we got a complaint that involved that person, then we would probably just refer that off to the nursing board. If they were a dual licensed person in some way, then we would have to look at that jurisdiction and see who's what license they were kind of working under when they did those actions. If they were doing Botox or something like that, it would probably be more so the Board of Nursing, because you know, there is some, my understanding is there's some allowance for those type of procedures under the Board of Nursing where there's really none for our licenses that we regulate here at the office.
Thanks.
Was that Olivia who asked that?
Kim,
Oh,
candidate.
it was Kimberly.
Oh,
Thanks,
Sorry.
Kimberly.
Kim, I have some information from both boards that might help. Might help you.
Perfect.
Might answer some of your questions.
Okay. Thank you, Sammy.
I'll send it to the whole board just so you have it.
All right.
All right. Thanks, Trappist.
Thank you, everybody.
Sammy, policy report.
So we have we're in the short legislative session for the legislature. I think it only lasts 60 days. It's supposed to be, it's not supposed to have any type of big ticket items, high profile items, or however, that never is the case. So HLO has a couple bills that if goes through may affect us. And actually Bob has been tracking these more than I, but the first one is House Bill 4011, which would bring on another licensing program to HLO for dental labs. We really don't even know how many there are in Oregon, to be honest. So, so that's to be wait and see. The biggest, so we would be licensing them. It's pretty basic licensing requirements, and it actually exempts one of our other licensing groups to insure us. 4071 is the health professional temp license, which has now morphed into a task force. So if you've been around long enough, then you know that this topic comes up about every 12 years. We're kind of, how do we revamp boards, or should we have a super board? Should there be a giant oversight? So this comes up every about 12 to 15 years. So a task force that would be made up of different other board representatives, none from HLO or really any under OHA. They're all independent boards, which was surprising. Then they would report that information back to the legislature, and then 2 compacts for in related to mental health. In there, it does call out HLO to provide information if asked. What information? We don't know. So to be determined. And that bill, Bob, where's that bill?
Oh, great question. I do believe it is,
Did it pass out of the health committee?
it may be on its way to Ways and Means.
Okay. So more to come. None of these have really affect you. The only one that would maybe slightly affect you is if the percentage of dental labs increases dramatically, and it could change your percentage of your small board percentage, but I don't anticipate that. I have no idea what the fingerprint wrap back is, so I'll let Bob take that one.
Excellent. Thanks, Sammy. Yes, the fingerprint wrap back does not impact this board. And it's actually something that's new, and we're learning about it as they're trying to bring it to legislation, which basically is some of our programs and a lot of the programs around the state, prior to being issued a license, you have a nationwide criminal history check via fingerprints. And the wrap back, if a agency becomes a member of the wrap back, anytime an individual has their fingerprints on wrap back, and if they are arrested or convicted of a misdemeanor or felony, HLO would be informed of said arrest or conviction. It would impact boards that fall under ORS 676-150 that have a mandatory report. And we have a few of those, but there's some pieces of it that I actually have a meeting right after this with the state police that we're trying to iron out. because we don't have, we do have boards that fall under 676-150 that have to do the mandatory report. But there's a question about whether or not the fingerprints will be rerun annually. And we don't have that provision for any of our boards. So there's a couple questions that I need to get answered, but that's what Rat Back is. It's a voluntary thing from the agency, and if we do not subscribe to it, then it's no problem. And if we do, the information that we get does not impact this board. It would only impact somebody that is required to mandatory report. And that is it for me, for legislation. Sammy, was there anything else that you had?
No, sir.
All right.
For those of you that don't know what mandatory report is in the licensing world, for like midwives, if somebody's doing something, if a midwife is doing something that's out, against the rules or the laws or criminally, then they another licensed individual has the is mandated to report that's happening. So just a little side note, because there's other mandatory reporting that wouldn't be related to licensing. And those are really directed at like legitimate healthcare providers. Not legitimate, but ones that you would think are healthcare doctors, things like that.
Okay. Chair, next item is public and interested parties.
Yeah, so I was going to ask a few questions about items that people would like for an agenda moving forward. Should we discuss that before we ask for public or interested parties feedback, or should we do the public and interested parties feedback first? What's your recommendation, Bob?
Public and interested parties feedback first, since that's how it's laid out on the agenda, and then it would come under other board business.
Wonderful. Thank you. At this time, the Board of Certified Advanced Estheticians will hear public or interested parties' feedback. Members of the public, please wait until you've been recognized. Once recognized, please state your name and affiliation to the board for the record.
Did anybody indicate they wanted to say? Okay. Any of the public members want to say something to the board? Questions for the board? If you do, please make sure you email Carrie Edwards. Okay. Chair.
So I think at this point, we've covered most of the agenda items. I think one of the things that I just wanted to get some feedback from the group on, I feel like you guys as an agency are always there and answering our questions and keeping things going, but I know we have a lot of new members and we've been working through some of the new laws and rules, so we haven't really gotten the opportunity to discuss things that we would like on upcoming agendas, things that we can do to be helpful to our peers in the industry, or kind of make a difference, which is why most people wanted to help and be part of this organization. So I guess I would like to just get a feel for what we can do moving forward that will be helpful, like what we might want to put on our agenda.
Okay, and just for clarification, and to bring it into the reason for the board is, sure, it's to help, but it's also to help the profession and the professionals, but it's also for public safety, correct?
Yeah, I mean, to me, they're one in the same.
Yes.
Certainly, and I think one of my concerns that I would love for us to help facilitate in regards to that very specific thing is our communication with our advanced estheticians on rules and just making sure that our communication is really clear so that they're out there operating safely.
Do you have something specific in mind?
It's interesting, and Sammy, I would love your specific feedback on this, but I feel like sometimes the information is a little bit hard to find, and I think you guys always have, like, we have this, I've asked questions before, and I will get a Q&A that answers the question really beautifully, but I think sometimes it's a little bit hard to find. Is anybody else finding that? Like, I'm getting a lot of questions about rules and laws, and sometimes I'm even having a hard time finding where to direct them. Are any of our other board members having that issue?
I know I haven't, this is my first board meeting, but I have already had people texting and calling and asking questions where they could find this or that. And I said I would try my best to find out. And so, yeah, I guess communication and easeability of locating information on the specific licensure would be really helpful for the public. They're having a hard time finding the answers to their questions.
So
And
sometimes,
that was
and
Christina.
a lot of cases, it says, Sammy, there is no information to find.
Okay.
Like, we don't do FAQs for every device on the market. That's not a thing. So if that's what they're expecting, and I know that is a lot of what they expect, that's not out there. The rules are meant to try to help. Of course, we know how that goes. Clarify what the laws are. And then FAQs sometimes will go a little farther. FAQs give us a little more flexibility. The laundry list of FAQs I'm supposed to write, I don't even know how many there are. I think it's like 31 now. So we email everything. I would love to hear how other mechanisms that you think would be more helpful, so that people get the information. Hard copy mailing, because emailing is what we do now. Are there other means for that? Is there associations that we could get the information to, or where there's membership, or because we have what we have, which is the emails or addresses, and help. I want to help me help you.
Thank you, Sammy. I just want to I want to ask a question and clarify. So if there is a new rule or some new guidelines and you send that email out, we can find that also in writing in the rules listed online. Is that correct or incorrect?
That is
like the
correct.
FAQ. Okay.
No. Oh, I think maybe now I see what you mean. And it's not common, if there is an we don't usually do FAQs to clarify a rule. If there's a rule, the rule is the clarifier. But they are in two different locations. Rules are in one location and FAQs are in another. And maybe that's the issue.
I think that is correct, because the FAQs are so helpful and so well written. And I do think that people are having a hard time finding them. What is everyone else finding with this topic?
And do you think it's mostly practice related?
I do.
Okay.
And can you just tell us, Sammy, where is the FAQ?
So
in
the
regards to the website.
FAQs for you guys. Where's the web? Where is the web? Okay, so if you go to our main web page, I could share my screen here. Hold on. Share a screen. Windows. Web. So if you're on the main HLO website. Can everyone see that?
Yes.
Yes.
Okay.
Yes.
So OHA, PH, HLO pages. And then if you just scroll down, it's like 2 clicks, 1 click actually, to the Advanced Aesthetics Board. Here's where people get messed up. Ta-da! You have to know to click on this little tiny link here.
Okay.
Here's where people get like, what do I do? And then all the way at the bottom is where you'll find your practice clarifications. So maybe it's the way the delivery is on the web. I don't know.
Well, I knew that you had the information. This is Christy now. I knew that you had the information, and I've seen such clarity already written out when I've asked, but I wonder, I mean, that's very helpful just even for us to know that. And I
I'm
mean, it would
going
be
back.
really cool if it was a quick link.
So if you go to cosmetology, it's the same scenario. So you go to their page and you can scroll down and they have all the fields of practice. And then, so let's go to estheticians and you'll see that, I'm sorry, that's not true. That's a lie. Cause is the only one that has it on the publications page. Maybe that's where it should be. And we had a conversation about transitioning all of them there for all the boards, that we just haven't done it. So you can see that cosmetology has many, many, many more.
This is Christy Knapp. I do feel like we have this overlap with cosmetology. And so having that really clear and in the same place, I know would be helpful. And then I also would like to suggest, not to add anything to your plate, but even maybe it almost would be nice for the practitioners to say, have questions about rules, be sure to check out this. I mean, I think that would be really helpful because I feel like there is a lot of confusion about where to find it. But I think you guys do a great job of that information. I just wasn't clear on where it was.
Yeah. So what maybe we could do is, so if you can get to the board's main page. So if you could go to the HLO and get on the board's main page, no other clicks but that one. Then this quick links. I mean, laws and rules is right there. Fees is there, licensing information. We could do publications, comma, FAQs, and resources. That might be more helpful so that all of this, like, just like it is for cosmetology, we could do that for all the boards and like make sure the FAQs is in there, or practice clarifications, whatever you want to call it. Maybe that would be more helpful. I don't know.
How is everyone else feeling? This is Christy Knapp. I feel like that would be so much more visible so that people would have access to more information without getting confused. How is everyone else feeling about that?
This is Jamie O'Neill. I agree with that, having it a little bit more clear in that section.
And I don't know if Callie is on the call, but she's actually in charge of the web, so she might want to weigh in. I don't know if she does or not.
Yeah, I don't know if she's on. This is Bob. So what we can do is we can research whether or not we actually can. I mean, we can probably put whatever we want in publications and resources, but whether we can expand that title or not, I don't know. We can do some things, and then the layout is dictated to us by OHA or whomever tells us that our web page is, this is what it's going to look like. But if we do that, if we can change it.
You don't think we
know,
could add end FAQs on there?
I don't know.
I can't imagine we can't. These look pretty
I don't know.
customized.
But we can certainly, if we're going to put them in that tab, that I'm sure that's up to us. And if we did that, we would want to make sure we did it and let everybody know that it's done, and then we'd have to do it for each program. So just try to keep it standardized.
We've communicated in the past in a lot of different ways. We used to put things in renewals. We used to, you know, like if we had a flyer, we do put it in a renewal, or if we wanted to put links on the renewal. But even then, I think people mostly, you know, apply online or renew online anymore. So maybe it's just more frequently sending just general emails saying,
This is-
hey, here's a reminder, we're here, and here's where you find stuff. Maybe that would be helpful.
This is Christy Knapp. I think it would, but I also think people don't need anything until it's code red or until
Yeah.
it's part of
Mhm.
their, like in my practice, I have this question and then they're just scrambling to look for it. So I think it's a little bit of both. But I think them being able to find it with ease, I think there were just a few questions. We knew the information was out there. We just weren't completely clear on how to get to it. Anyone else have any anything on their list of things that they would like to bring up with respect to our rules and regulations and public health or safety, I should say? All right. Are
This is
we?
Canada, Kimberly, one, and maybe I just need to do a little more investigative research. I have to say I have not gone through recently all of the rules and regulations. But for just like throwing out an example of someone having difficulty finding, I know this could be a couple years back, but the verbiage for a certified advanced esthetician, correct me anytime if I'm wrong, says that they are not doing ablative services. However, then some of the machines that they're trained on in school are listed as a partially ablative or nanofractional. So has that been clarified? Like just something like that. Ablative versus nanofractional ablative to me still is ablative, even if it's nanofractional. Something like a specific rule like that. Is it easy to go find clarification?
There is not a rule like that.
Okay.
But, so I guess that would kind of wrap into curriculum and what's being taught in schools, what devices are, you know, they can use, and what procedures. I'm just going to throw it out there that maybe tattoo removals are you talking about? Or are they for other types of procedures?
Other devices have ablative capabilities to them. And I thought that the verbiage for the certified advanced esthetician stated that they would not be doing any ablative services.
Oh, okay. I think I know what you're saying. Yes, no, they can only, it's advanced non-ablative aesthetics, and non-ablative is defined in the law. Is that what you're talking about?
Yeah. So
It is.
It is defined.
Yes, but ablative is not.
Oh.
We've tried. Trust me, I tried.
Okay.
But we let it go.
Okay. So, because that is confusion, you know, out in the practical world.
And maybe this is for future rulemaking. I'm not an expert. I'm really not smart about it at all. Just go there. I think most devices have capabilities to do a lot of things that may be outside of the scope for an advanced esthetician. And so maybe there are rules already that say you can't work outside of your scope, but maybe there's something about devices where even if it has that capability, you know, it's up to you to know where the line is. And I don't know if that is something that would be more clarifying or not.
This is Christy Knapp. That's always just going to tie back to a rule, correct?
Or an FAQ. Probably an FAQ.
Okay.
Yeah, no, that is I mean, and here's kind of the rub is for regular aesthetics, we have a line now. And it's not below the epidermis unless it's natural physiological effect. And then there's advanced aesthetics. And it's kind of in the middle. It does say that advanced aesthetics can practice medicine, exempts them from certain things in medicine in the list, you know, skin rejuvenation, blah, blah, blah. And then where's the line between non-ablative and ablative, which we don't, the legislature didn't give us that. So it's kind of like a stepping stone, and we're missing some steps. So probably an FAQ would be it, but I don't know how that would shake out in the end. And sometimes be careful what you wish for. You know what I mean? So that's all.
David.
Listening to you talk, I know you have new members on the board. Would there be an advantage to having a session during one of the board meetings? It's just kind of an orientation to the overall rules, kind of a refresher. Because I think Christina said something about, you know, she's already as a brand new member getting inquiries and trying to, you know, be of service to the licensees. It seems like, you know, board members should have a pretty good understanding of the general rules and talking about access on the website and everything. It would really be a service to your industry.
Funny that you say that, David, because yesterday we were talking about this, about kind of where, and I was talking about it this morning in the orientation for Olivia and Christina, kind of where information is important. And it's like kind of goes to what Chrissy just said. It's only important when it happens right now. Right now. Now it's important. It wasn't important when I got it 6 months ago, but now it's affecting me. So when I give my presentation about rules, but you're not in rulemaking, doesn't really apply right now. So and always keeping board members apprised and you know, focused on what the intent is, consumer protection. So we were thinking about doing like an annual short 20-30 minute presentation, just kind of bringing everybody back to focus on what our goals are, you know, what the board's here to do, kind of, and maybe even what the plan is for the year. You know, you could do it a ton of different ways. But we've actually been talking about that, and then where we can fit in these more detailed pieces like rulemaking, racks, where they actually are relevant and will be meaningful. So those are things we were just talking about yesterday, me and Derek and Carrie and Bob. So it is in the works.
And I think, I mean, number one, I mean, do you think that would be helpful for the new board members here, maybe weighing in on that idea of what Sammy's just talking about? And maybe even address the idea of maybe some ideas about how to relate to individual inquiries, because, you know, what can happen is things can get blown out of proportion. Your best intent is to share information, knowledge is power kind of thing. And in your effort to do that, it's real easy to maybe set somebody off, ramp them up because of what you're saying about, you know, a given rule. So, I mean, the idea of, you know, how far should you go? How specific should you go, as opposed to being a referral source back into the rules themselves?
Yeah. And always, if it were me, I would just put it back on HLO and say, you know what, they're the keeper of the information.
Yes.
Well, you just call Sammy or Carrie or call anybody, and they'll get you to who you need to, you know, who you need to talk to. So the burden isn't on you to try to find it on the web or whatever.
Right.
So loop us in an email or whatever. That's a great question. Those were great questions. Thanks, David.
Yeah.
Christina.
Yeah, Christina here, Russ, and I think that's great, David. Thank you for helping me kind of get that point across, and Sammy for mentioning who I can direct them to, because I don't want to be the one to relay it. I'd rather than send them a link or a phone number, and that's where they could find that information. And then so maybe Sammy, as the orientation, maybe that is a quick overview of where we can find certain things to point the public in the right direction. Maybe we can add that or somehow have a review of that at some point.
Yes, absolutely. And I think what we can do at HLO fairly quickly is maybe just send a board member blast, like, hey, here's kind of your contact people at HLO. And that can be done in like 10 minutes. So, yeah, I think that can definitely be handled. We will get on it.
Great. Any other topics that people want on the agenda moving forward? All right. If no one has anything else, we can adjourn the meeting.
Okay. If things come up, feel free to give us a call or an email. We're here.
All right. The Board of Certified Advanced Estheticians meeting is adjourned at 10:02 a.m.
Thank
Excellent.
you.
Thanks,
Thank you.
everybody.
Thank you.
Thanks. Bye-bye.
Thank you. Bye-bye.